Perfect. We're live with Giovanni Colella, Chairman and CEO of OODA Health. It's awesome to have you here, Giovanni.
Thank you for inviting me. It's a pleasure.
Yes. So you've done a lot in the healthcare system, and maybe we can start with what you guys are up to at OODA Health and then work backwards to see how you landed here.
Yeah, well, OODA Health was born uh, in the brains of several people that had left Gaslight with me after our IPO. And we all came to a common denominator conclusion that was still 80,000 feet at that point, that the administrative side of the healthcare system is an area that needs tons of improvement. And why is that? Well, there's something highly illogical in our, well, there's many highly illogical things in our system, and probably if anybody listening to this podcast would sit down with me and you, John, and redefine and design from scratch the healthcare system today, we will design it differently. The reality is we are inheriting a system that for many historical reasons, and some of them very understandable, is misaligned. And so the best thing we could do is try to improve it and try to make the best out of it as we continue evolving. It's an evolution, not a revolution. And we evolve either to public options and different forms of payment systems or things like that, which brings me to where we come in with OODA. None of us co-founders are scientists. We're not smart enough to be the guys who invent. Well, I should talk for myself. My co-founders are very smart, but we're not going to create the COVID vaccine or things like that. Those are game-changing things that change the world, and within the moment they come out. It takes years to get them. The moment they come out, we do understand healthcare, or at least we've been in the industry for a long time, and we understand the technology that healthcare adopts today. And so that's where we need to focus. And we looked at where the major areas of administrative improvements are. And we wanted to be at the interface between payers, providers, and consumers. We actually haven't seen, and maybe I'm wrong here, correct me if I'm wrong, but we haven't seen any truly game-changing healthcare company that has been able to bring together all three. And so we decided, okay, let's focus on the payment system, because you have copays and deductibles that are in the hands of consumers and are very challenging to collect for providers. So they create a mountain of bad debt and therefore bad will on both sides. And you have the whole claims processing, prior adjudication, a whole way of getting paid for the physician that at this moment in time is making everybody unhappy. The payers unhappy because they have a lot of administrative cost around that. The doctors are unhappy because they're getting paid late. And the consumers are unhappy because they get what we call EOB, which is not a claim, and then they get a claim. There's an opacity for consumer that doesn't exist in any other industry. That's where OODA comes in. We're trying to bring together all three players and go improve, I would say dramatically change the payment system all the way from the consumer side of the payment to the provider submission of their claims and reimbursement for those claims. We partner with several health plans, several providers. They all invested in the company. And we've been around now, I think it's our fourth birthday, and we're growing pretty dramatically. Yes, we're growing pretty well.
Amazing. And how does a consumer find OODA? Do they land on the OODA website, or is it all?
As of today,
yeah,
it is offered to you by your health plan, right? And by your provider. Your provider is working with XYZ health plan, which is working with OODA. And therefore, the members that are with that health plan in that panel of providers, of that specific provider, will be offered OODA. Things are evolving, and we plan to actually expand to all the membership. And I won't dwell too much into that, because obviously it has implications for our new product development and what we're going to be launching in the next 6 to 7 months. So what I would encourage anybody who is interested, and I don't know how many people really are, it's not the sexiest topic, but it's a super important topic to follow our company in the next 6 months, and you'll see some very interesting announcements there.
Yeah, maybe because we can't go too deep into the future, maybe we can go a little bit into the past. So, when did you realize that when did you realize that the problems that you were solving for were problems? Was this during your time as a physician, or was it really when you started Castlight that you realized that these were problems that you were setting out to solve?
Well, Casai wasn't my first company, so I had already tried to solve some problems in the healthcare space. So we could rewrite history and make it very romantic and say that I was, really thinking about it and there was this big problem or things like that. The reality is a little bit different. The reality is, I decided not to practice medicine as a physician anymore for many reasons. But that was one of the reasons was not because I wanted to start a company. It wasn't really, it was more personal reasons that had to deal with my father, my family, and things like that. And so I said, okay, I can't do this well. And then the second thing that happened is I definitely, my wife of now, whatever, we've been together more than 30 years, realized and helped me understand that there was no way that I was totally unemployable because there was no way I was going to work for somebody. And so I was left with the optionality that I should start a company. And that's, it's the only way that you can get going if you don't want to work for somebody. There's no other option, right? Uh, and that's really how. So my first company, I just, look, I was out. I need to start a company. I had a couple of good ideas. I really didn't do a deep McKinsey-like analysis. Is the market big or things like that? It was much more of a gut feeling that was a problem that was there, and that
And what was that?
that was relay health. And at
Okay.
that time, there was when we started, it obviously evolved quite a bit to what it is today. We sold that company to McKesson, but it started truly as a patient-physician communication tool. There was very, very little telemedicine. There wasn't even a code for telemedicine, a CPT code. So that's how it all started. Now, the idea was always, well, I shouldn't say always, even there I'm rewriting history. The idea was very superficial in a way, but it turned out that it did offer a lot of good opportunities, and was like, listen, if patients and physician can communicate through structured, at that time we were saying email, web, cloud-based, and it's all driven by logic, by I don't want to use the word AI because that would be overselling what we were doing, but machine learning and algorithms, really simple algorithm. You can streamline a lot of what the physician does and allow the physician to actually see more patients. We actually got some health plans to even pay for what was called a web visit in those days. But what really I wanted to do is once you're sitting on that desktop of the physician, and in those days, keep in mind, we're still using Blackberries, right? So actually, when I started, we weren't even using Blackberries yet. So there was no iPhone or anything like that. And we were said, let's get on that desktop. We own then a piece of real estate that is exceedingly precious. And in my opinion, if we could get a good panel of the membership using it as the internet was growing, that piece of real estate, in a way, was more valuable to us than the entire electronic medical record or electronic health record. Because the data that was put in the electronic medical record, especially then, was very little, and the penetration of the EHR was very small.
How did you even come up with that being the problem? And as like a physician, was it something that you experienced firsthand? And then how did you decide to even, like, as a physician, did you go find a CTO? How did you even decide to build that product? And how did you go about building this product?
Yeah, no, that gets a little bit more complex, right? Because part of it is luck, part of it is art, and part of it is actually structured management. I would say that I would give it, if I did a weighted average, I would say 70% is luck in my case. 25% was actually understanding gut, feeling for where we're going, and then 5% was my management ability skills, which really boil down to hiring the right people. It's very
Okay.
simple because as a manager, I'm a disaster. Being aware of your limits and hiring the right person is what really helped me. So, how did I decide it? Well, it wasn't, I mean, come on, you don't need to be uh, Albert Einstein to realize that patient physician communication is probably the most precious communication that people have, right, with their doctor. And it's exceedingly complex now. Try to call your physician, even now. Try to call them, try to get an appointment, try to get things back, try to get.
Headache.
And we were one of the first ones to then do e-prescribing and all that stuff. Huh? But in those days, it was nothing. I mean, literally, you would call, and yes, there was the haha moment. Many entrepreneurs have that. I had it too but it was more of it was more like, okay, this confirms what I'm thinking when I really needed myself to reach out to a physician, and I'm a doctor, and I
Yeah.
have friends, and I couldn't really talk to them, couldn't get an appointment, they wouldn't call me back. I mean, if that happens to me, what's going to happen to the average person? In the meantime,
Yeah.
I noticed that people were going and doing these funny things like buying books online on this. I was one of the first ones to use Amazon. It was pretty clunky and difficult. And then Yahoo came out. And so I'm like, wow, there's a search engine here. What is this? And so I said, okay, this is growing. So now you have a area that is growing so fast called the internet. You have physicians and patients that can't communicate over the phone. Then once you're there, you really don't need to be incredibly smart to put
Yeah.
the dots together and say, wow, there's a business here, maybe.
How about payers? Because I was watching a talk that you gave, I think, with the president of Anthem at like a health conference, and I noticed like now
There we go.
you guys are like, you've been in this space, you're buddy with some of these guys. But what was it like getting your first payer on board at that first company?
Yeah.
Like, were you
So
cold
first of
calling
all,
them, cold emailing, getting the dots
yeah, first
connected?
of
How did that
all,
work?
let me start by saying that I appreciate you saying calling me buddy is probably an overstatement. Do we have, well, first of all,
Maybe it's the Italian in you that
I'm
you
sorry.
have that the warmth of you guys being
Oh,
on
thank
stage
you.
together. I'm like, these guys hang out.
Oh yeah. So well, first of all, I was on stage with Pam and Gail. I mean, I was with two rock stars, the best people in healthcare. And you also, when I started, I have to say, I was this was 30 years ago, so I was in my 30s. I was very much convinced that payers were useless. I'm the first one to say it. I think, there's a bunch of guys with computers sitting between the patient and the physician. And all they do is streamline money, but add zero value to the system. And I thought that therefore, people running payer systems were pretty much, I mean, I wouldn't say bad people. I always knew they weren't dishonest, but I always thought, they're dirty capitalists that are just trying to make a living. And in healthcare, that's a tough one. That's a tough thing. And then you grow, right? You work with them. You understand. You realize it's not like that. You understand much more of the payer system. You understand what the value is that they bring to the market. You understand what are the constraints they're working through. And that was a process of maturation that helped me grow as an entrepreneur, and really understanding two things. That first of all, when you do a win-win deal, nobody should take the hyphen. It truly, when you're younger, you're like, every win-win, you could negotiate down to the comma to try to win. And that was a learning experience for me. And the second one was, there really aren't bad guys. I mean, 99.9% of the population are good people. Then there's a group that really tries hard to be morons, and but it's not natural to them. It doesn't come natural. And the payers, they're really, really good people trying to do the right thing, and sometimes the incentives are misaligned. Therefore, it's really hard. It's the famous thing. It's very hard to have somebody do something that goes against their paycheck, right? And so once you come to that understanding, it's a whole different conversation, because you don't go in with an antagonistic mode and say, look, I know it all, you don't, I'm going to change you. No. Teach me what you're doing. I'll tell you how I look at it. And guess what? Every time I do that, by the way, I really, literally 99% of the time I do that, payers say, yeah, but, and they explain to me why it's difficult. Yeah, and that but is not but I don't want to do it. It's but here are my constraints.
Mm.
And every payer they're different. So for example, Gale manages one of the biggest payers in the United States in 14 states, publicly traded. Her constraints, both from a regulatory vis-a-vis marketing, vis-a-vis business issue, are different than somebody who's managing a local health plan that is non-for-profit, right? And so you have to calibrate also and understand. Gail is trying to do the best for her shareholders and for her patients, and it's a complex thing, you know.
Yeah.
You don't you know, there's pension funds that have invested in her company, and you want that to go well too. So how did I get there? It was my maturing, and now I'm in a position, and I'm lucky too. You know, my companies did well. I've been around for a long time. People know me, and we've developed a fundamental trust in each other. There were moments in which I relied on them to not throw me under the bus, and they never did. And in exchange for that, there are moments when they get in trouble or they can get upside from my companies, and they're always welcome. Always. I will always stand by them. So, and by the way, we never made it personal. That was
Yeah.
important too. I never made it, okay, you're a bad guy, I'm the good guy. It was always about misaligned incentives.
Mm.
And they never made it personal. I never felt insulted, even in the moments in which we had really hard moments with the payers. You know, I was demanding price transparency. They didn't want to give it. I never
Yeah.
felt that it was a personal attack on me by any means.
Yeah, we're in the early stages of those types of conversations and piloting with some payers, and it's an interesting process because you look at where they really want to go and what their limitations are, and a lot of it comes down to
Yep.
finding alignment. And uh,
Yeah.
so that's really interesting. As you went from your first company to Castlight, and then is it Brightline? Was
Yeah. Brightline is my last one. Yes.
Brightline? Um, I guess how did those conversations and those relationships with payers mature? Both of those are pretty different concepts, but yeah, where did you find maybe a gap in their system that you were then aligning yourself with as a business?
On Brightline, I don't know how familiar you are with the business model. The CEO is Naomi. She's doing a phenomenal job.
Mental
Right.
health for kids.
Mental health for
For
kids,
kids.
very
Yeah.
good. Yeah,
Yeah.
and it is an area where the asymmetry between the demand and supply is staggering. And one of the reasons why getting treatment for your child now is so difficult is that the reimbursement is awful, right? And there was a stigma and all that kind of stuff. So, if you want to bring the payers on board on that, you need to really build the case on why their investment being so bad, they can't build good networks and show them that there's a demand for those networks. Now, guess what? When you go to the payers, they're not stupid. They know that, and they want to do the right thing. That's why now we have several payers on board. The problem that the payers had is we, and I'm a psychiatrist too, we are our worst enemies, right? We completely refused in the history of psychiatry to do outcome-based measurements, psychoanalysis was beautiful. You could go on for 25 years collecting an annuity, and it would keep going. So the payer's like, okay, how many times can you bash your mom and bash your dad for what has happened to you when you were two? I'm not going to keep paying for that. And they had their point. They had their very fair point. So Naomi was very good in structuring deal with payers, and I'll let her elaborate on that, in which it really, we are totally open to learn as we go with them and develop value-based payment models. Not at the beginning, because everybody will lose their shirt at the beginning. You got to learn how to do it. There's also a reason, again, it's not that psychiatrists are stupid. Sure, the incentive even there were misaligned, but it's a hard to quantify out. How do you quantify happiness? How do you quantify adjustment? How do you quantify doing better? And by definition, some mental illness are chronic by nature. So what you can really do is improve the status of the patient. But it's hard to say the patient is cured. And in all fairness, again, to psychiatry, the armamentarium, the toolkits that they had, have improved dramatically in the past 5 to 10 years, right? Psychopharmacology now is a well-established branch of pharmacology, and it wasn't then. So that helps, right? Can't hear you.
Oh, sorry.
Oh.
I said the way my brain works, Giovanni, is it sort of hops around, and I want to be respectful of your time. One question I was curious about, if you were there during that time, because it's in our space, in the corporate wellness space, employee well-being, we think about it a lot, and have seen it as one of those kind of landmark acquisitions. Was how did you and the team go about or thinking about acquiring JIF when you guys were at Castlight? Were you there during that time?
Yes, but I was already, to be very fair, I had already decided to leave the company, and it was obvious I was going to roll out right after that acquisition. So I'll comment only 80,000 feet there. Castlight realized that to offer the entire platform, their idea, it was important to have a wellness piece to it too. I believe wellness is an excellent component. It's an excellent feature of a bigger platform, of a bigger product. And that's how at that time he was CFO, who then became CEO, decided to move in that direction. And that's how they picked Jeff, and that's how they did the acquisition. If you probably noticed, I think I'd already moved officially to chairman before that, and immediately after Jeff was acquired, I left the company.
Well, maybe high level also, how do you think about the future of, and I'm asking again selfishly because we think about this a lot and maybe we can continue this, but at a high level, how do you think about payers and insurance companies, health insurance companies, continuing to double down and invest in preventative care and well-being, and how they go about doing that? Do you think it's going to be them doing it internally, or do you think it's going to be them partnering with technology companies, entrepreneurs, etc.?
Okay, there's a lot to unpack in this question. First of all, the wellness, well-being industry is a broad term, right?
Yeah.
There's many different types of wellness. There's all the way from life extension to today to diets. They all fall in the category of wellness. So even there, if I were you, I would break it down vis-a-vis what are the must-haves and the non-must-haves, if there are any must-haves, and they become more must-haves as they can show some kind of ROI that is quantifiable. Because one of the things I learned the hard way as an entrepreneur is if you can't quantify ROI, you can sell the vision and it works pretty well, but then that vision hits gravity. So that's very important. You really need to find a way to generate ROI, and productivity enhancement is a fairly weak ROI because it's really hard. It's squishy. It's very squishy. Okay, so now will the payers invest? I would say, to answer your second question, that I feel very qualified to answer is it going to be entrepreneurs or is it going to be payers? And the answer is all of the above. I think that payers have, and it's been for years now, completely realized that just by nature, if you're working with a payer and you have a 7-8 hour job during the day just to get the business running the right way, and big organizations, I'm almost astonished by how many meetings they manage to pack in one day and how many people can be in these meetings and things like that. So big organizations have a lot of these things that are grinding and slow you down. So they've realized they need help from entrepreneurs. Entrepreneurs obviously now are very eager to commercialize what they do, and so eager to co-develop with payers. And if they get clever, they structure deals in which one has warrants, so they get them involved. I mean, that becomes a little bit of financial engineering, but in a productive way, because you really do align incentives. So you can make it work by aligning both. Now, the challenge is there. You really want payers that are visionary and understand the complexity. because it all looks good on paper, and then you're always going to have, the CFO and the controller. And once it comes to investments in the company and equity in the company, it creates layers of complexity that could slow down a startup, because the startup lives in the venture and then IPO world. The payer lives in the status quo world. So one is looking for fast growth and very few strings attached to that growth, and ability to get creative, even from the financing standpoint. Of course, nobody wants to break the law, but move fast, vis-a-vis the other one, the payer, which is as conservative as you can find it. So I always give a word of caution to entrepreneurs. Make sure you structure the deal very, very well, and look at 5 years in the future, not today, with in mind that the person that you may be dealing with today could be the nicest and smartest guy or gal in the world, but they may not be around in a year.
Yeah.
That big organization, the turnaround, they move around jobs. So all of a sudden, then the other guy comes in or gal comes in, and I'm dealing with a situation like this now with one of our partners. It's fine. At the end of the day, you work well even with the new one, in our case at least. But
Yeah.
it takes a lot of work there.
Yeah. Switching gears a little bit, I like on the second half of the conversation to get a little bit deeper into you, and something that, like, a theme of this conversation is a lot around aligning interests, which I think is really interesting, and something my co-founder has actually taught me a lot about, and is great. I like to ask, is that something that was always inherent to you? Is it something in terms of your upbringing, of what your parents taught you, or is that something that you've honed in over a period of time?
Well, first of all, there's an implicit compliment here, so I want to thank you, because I think you're thinking that I am somebody who really believes in fairness, and that means a lot to me. And I would answer all of the above. My mother really, really was somebody totally dedicated to making the world a better place, and she's been an incredibly influence in my life. And then you grow up. First, I grew up in Europe, and Europe has for good and for bad, a difference, especially Italy, of all European countries, a sense of community that is exceedingly strong. I mean, I have my in-laws here living with us. It's like we live in the village, right? And so that gets inculcated in you. And when you live in a community, you grow up with the idea that you have to, the person next to you is your brother and your sister, right? At the end of the day, sure, everybody wants a little bit more. That's normal. That's normal human beings. But there's a very fine line between self-interest and greed, and never crossing that line, because otherwise you're not going to be part of that community. And that goes in building a company, is exactly the same thing. And you know what? If you do the thing that unfortunately young entrepreneurs frequently miss, if you do well, how well do you want to do? I mean, truly. I mean, I was reading the other day, it's on every press, so you can't avoid it. I feel bad, but the famous divorce that is happening now. And when you're, the Melinda and Bill Gates divorce and things like that, you don't buy happiness. You really don't. You have billions. What's the difference? What are they doing that is much different than what you and I can do? And once your company goes public or something, you'll be in a different financial situation. What are they doing? What's better? And what's different? And you really come to that realization is way more important to have very dear friends next to you. Once you've reached a certain financial stability, I'm not denying that. Unfortunately, in our society, there's still too many people that live paycheck to paycheck. That's very important to get them out of that. So, for example, and I don't want to get into politics on a podcast, but I am absolutely in favor, although I will be absolutely creamed by it, for the tax raise that Biden is proposing. The return on capital has outweighed the return on wages so much in the past 50 years that the best thing that could happen to capitalism is that actually we start injecting some Keynesian or Marxism into it. Otherwise, we're all gonna pay for this. So that gives you the sense of community that you live with. And now, make no mistakes. I'm no Madre Teresa. I just had a situation with a founder actually, in which he or she, I won't say the gender, otherwise you understand who this person is. So, well, I think you should give some equity because you can't put in enough time. And my first reaction was like, no, why should I give up some of mine? And then I'm like, wait a minute, is this who I want to be? Is this what I do? And so I realized this person was absolutely right. So my instincts, I mean, it's like, Winston Churchill, I thought, had a great definition of Americans. You can always count on Americans on doing the right thing after they tried everything else. That comes to me too. That comes to me too. I promise you, you can count me on doing the right thing, but I'm human.
Yeah.
I will have my reactions and things like that. So it's part of life, right? You get to a point in which you realize that it's way more important. And I'm blessed. If you look at my companies, people have been with me company after company after company after company. And I think there's a reason for that. It's not because they made money, which doesn't hurt, of course. And and believe me, I believe in capitalism. So I'm not advocating for a socialist revolution. But they're coming because they also enjoy the fact that we can work together, we can share the benefits, and they know that ultimately we'll have our disagreements, and I'll do a ton of wrong things, but we can trust each other. I'll close by saying I have a say with all my partners. I say we need to be in a situation in which if I walk in a room and you have a smoking gun in your hand and there's a dead body there and you tell me I didn't do it, I believe you. I trust you. That's the level of trust we need to have.
And you've mentioned your wife, you've mentioned your mother, you've mentioned like learning a lot of these lessons in the business setting as you've matured, and then also within your team. Are there other ways, other practices maybe you have in accordance with your own well-being, mental health, that have allowed you to discern between what really matters, what doesn't? Staying focused.
I know what you're getting at. Yes, I'm a little bit of an odd duck. I meditate every day, 2 to 3 times a day. I eat only once a day in the evening, so I can meditate in the morning. I can meditate at noon. I find in Buddhist meditation a really real source of inspiration. It truly is. It centers me, and it helps me get there. And so it's meditation is now you have to exercise it, you have to practice it, you have to believe in it, and it's a very spiritual thing. It's not, I mean, I have nothing against it, but it's not a religious thing. Make no mistakes, I have nothing against religious. I actually respect it a lot, but I'm more in an agnostic state when it comes to pure religion. But it's a very spiritual state. It's the understanding that there's something bigger than us and something bigger to believe in, and it centers you. It really brings back to who you are, who you want to be. It brings you in touch with yourself. Now, I started this a long time ago. There's now plenty of studies. I found out that I'm actually on the wave of what's fashionable because I'm not by choice, but I'm doing what they call intermittent fasting by eating once a day, only in the evening, and I'm meditating, which is now becoming a big thing. So I'm also at 63, almost 64, a very fashionable guy, which I've never been accused of. It used to be seen as odd, but again, it doesn't fit for everybody. I don't preach it. I'm not saying it's the right thing to do. I'm not saying you're bad if you don't do it. What I do encourage people is try it. It gives you discipline. It gives you self-centeredness. It helps you be a better person. So, but I know, it's, you always see me with bracelets. It's a staple of mine because it helps me meditate. And you'll never see me without bracelets. Never. I don't think you could ask the people who have worked with me. They almost make fun of it. And
in many ways, I wanted to talk to you, Giovanni, just because you seem like a cool guy. So I'm glad we got to hit on the bracelets, the meditation, the intermittent fasting, because I knew there were some other secrets in there. I'd like to end the conversations, one, by thanking you for being here. Two, by asking, what are you most excited about as you think about the next 5 years of OODA Health, and then maybe even just taking a step back and thinking about the future of healthcare and medicine?
Okay, so let's start with OODA Health. I'll just say that I'm really excited because I do believe that we are at an inflection point in which OODA Health can become the official platform for payments in healthcare system. and really and span through the entire payment flow, all the way from the consumer to the payer to the claims to the provider, which then will allow to build around that new forms of payment. I think fee for service model served this purpose in the past. It's now, it's, we can't sustain it, and it misaligns incentives. On the other side, I do understand that value-based payment is more complex than just a statement, and it requires, first of all, an enormous amount of clinical protocols, which is good. We could that, but that part is not our. We could do it. The part that is very cumbersome too is how you pay for these. And if we can get to a new form of adjudication engine, a new form of prior authorization, we are way ahead of the curve on that. So that's my excitement for OODA. My excitement for healthcare is, well, first of all, I don't want to put a pessimistic note on this. I really do believe that we've had too much excitement too many times. I think we're at a point now in which we truly understand that healthcare is maturing. Americans are maturing. But unfortunately, for reasons that I won't dwell on here, we're in a very, very polarized country. So that will slow down. If you look at now, for example, the Democrats, they would like to do big revolutions, but they don't really have the Senate votes to do it. So it won't be a huge change. I think that the next 2-3 years, the parts that people will agree upon where the most impact will happen, pretty much overall, is in the Medicare space. And that's pretty much bipartisan at this point, although you could argue that in 1964, everybody was against Medicare, but try to take Medicare away from somebody today, it's never going to happen. Never going to happen. So you're going to have both from the wellness standpoint, the prevention standpoint, the technology standpoint, the platforms to serve the above 65 platform. And there's a tsunami of people coming in that space that are like me, the baby boomers. Next year, in a year and a half, you are going to start paying for my healthcare, right? So, because I'm going to be on Medicare, and I'm used to living with this, right? So I do everything. I do Instacart. I do for Whole Foods. When do I go to a store? I mean, everything there. Now I can't. I have no understanding of what I'm going to be doing for Medicare and how to do it. So you'll see incredible amount of things coming up in the Medicare space because it's a great business model. We will see Medicare Advantage. Well, probably that doesn't take a genius to say it will grow dramatically. But I actually believe that Medicare Advantage could become a model in the commercial side too, in the younger population. We'll see. Time will tell because, but it is a very good model and it's proven. Everybody said, "Oh, Medicare Advantage." At the end of the day, people will lose their shirt on it or things like that. For now, that hasn't panned out. We'll see.
It sounds like you already are planting the seeds for your next company. Maybe when you're maybe when you're 70.
That I won't discuss in public.
Okay, in private then. Giovanni, this has been awesome. Looking forward to continuing it. Thank you so much
Thank you, John.
for taking the time, your question, and answering my questions, even though they were all over the place. Excited to see what you guys accomplish in the coming months and years ahead.
Thank you, and good luck to you too. We'll stay in touch.
Thank you. Looking forward.
Bye-bye.
Bye.